Well, there has been an increase in hospitalizations in recent days as we turn our attention to COVID-19. South Africa reporting around 4,000 new cases daily, and the mortality rate is nearly 60,000. Well, the National Coronavirus Command Council meeting earlier this week. Many people are anticipating further restrictions, perhaps another family meeting. Or let's find out from the President and CEO of the South African Medical Research Council. Professor Glenda Gray, always a pleasure speaking to you. Prof, what do you think has resulted in this sudden increase in numbers? It has been ticking up, but the last 3 or 4 days there has been quite a jump, hasn't there?
So we expect this to happen in winter. As we go into the winter season, people start to move inside, they start to work, not be in crowded situations and not use ventilation very well. So there's always will be an increase in the coronavirus infections in the winter month. And just coming out of Easter and out of Eid, we also have had a lot of potential super spreading events. And so this is to be expected when people let their guards down and move around in spaces that there's very little ventilation. And so we do expect this, and it's obviously very concerning because the rates are going up in Gauteng, in the Northern Cape, in the Free State, in Mpumalanga, and in Limpopo.
I want to talk about the potential of a harder lockdown, especially around what, as you quite rightly say, the super spreader events and trying to get those under control. Before I get to that, though, Prof, let's talk about hospitalizations. We are heading towards a situation again, aren't we, where hospitals could find themselves under pressure, or is that too dramatic a statement?
We're already seeing the pressure in Gauteng, where people are having to open up wards to accommodate new cases of COVID-19. So the hospitals are starting to get under pressure, and certainly there are indications of that in the Gauteng province.
When it comes to a potential family meeting, we know the President had a meeting with the Command Council earlier this week. What would you be advising government to do to try and alleviate and try and at least manage the numbers of COVID-19 in the country? What needs to happen?
The big issue is the big gatherings, and the most important thing we should try and do is to limit big gatherings or ban them. Also, putting in a curfew also seems to help. That seems to help the movement of people in the evenings. And so mostly, I would say, trying to avoid big gatherings would be the biggest strategy, as well as limiting movement of people late at night.
There's been a lot of criticism, hasn't there, Professor, around the allowing of gatherings, for example, churches, casinos, cinemas. Those are all enclosed areas where there's still a bit of confusion around the 50% or 50 people or 100 people. I think it's very confusing to keep up where we are these days. Are those the kind of events that you're talking about? Because those kind of areas like churches and shopping centres, etc., can house a lot of people at the same time.
Sure, any event in closed conditions of poor ventilation and people being very close together will cause a super spreading event. We need to maintain our social distance. We need to continue to wash our hands and wear our masks. And sometimes when you're in a social gathering, particularly a large one, you tend to forget that you should not touch people, hug them, and you must also make sure that you maintain your distance. And so in big areas, particularly social areas, people are going to forget that. And particularly when there's alcohol as well, people let the guard down, and before we know it, people have been exposed to the virus. So it's very important to make sure that we do avoid big gatherings, and that we make sure that when we do meet people, we meet them in open spaces where there's good ventilation, keep our distance, wash our hands and wear our masks.
Prof, I've got 2 more questions to you. The one is going to be about vaccinations and vaccines. But I think, Prof, you knew I was going to ask this question. Should we close down the liquor stores? Should we lock away alcohol again?
Well, I think we have to try and understand what are the drivers of transmission. When we minimize alcohol use, it's about keeping the hospitals open, keeping the emergency rooms open. So it's not about preventing the spread of coronavirus. It's more about keeping our health system functional when there is a surge. And so I guess what has to happen is that the country has to look at its beds, look what it's been using their beds for, and try and minimize non-COVID beds as much as possible. So if alcohol leads to emergency rooms being full and doctors being diverted, then we have to address the alcohol issues.
We're heading up very quickly to 350,000 COVID vaccinations, especially the Pfizer vaccinations. Prof, I know we're still waiting for the Johnson & Johnson to be approved. In your opinion, are we getting these vaccinations out quickly enough for phase 2, the population that are 60 and over? Is this happening as quickly as you'd like?
I think in the next couple of weeks, there's always going to be a challenge about demand and supply. So there's not enough supply in the country to meet the demand, which is a good thing. And what we have to try and do is make sure that the supplies can get to the places where they're needed. I'm excited that so many people want to be vaccinated and so many elderly. And so when one sees the queues, it shows you that there's very little vaccine hesitancy. And hopefully that the supply will make sure that we can meet our demand. And so I think it's been 2 weeks since the national rollout has started. There have been lots of hiccups, but I'm very heartened to see all the elderly and people over 60 coming forward and getting their jabs wherever it is, whether it's in Alex Clinic, at Baragwanath Hospital, or in more remote parts of the country. It shows me that people understand the importance and the need for vaccination.
And I'm sure it's going to be rolling out even quicker as soon as we can get the technological glitches sorted out for registration. Professor Glenda Gray, it's always a pleasure speaking to you, just giving us your thoughts, your reaction so far to this increase, this sudden increase in numbers in South Africa. COVID-19, over 4,400 new cases in the last 24 hours. It's the hospitals, though, which are becoming a big concern. My thanks to Professor Glenda Gray from the SA Medical Research Council.